Good morning, everyone, and welcome to Medical Terminology 1160. Um, I'm Dr. Izzy, and I'll be teaching this course. As you know from the website, already wrote down my introduction. You have the syllabus, you have everything else. This is just a complementary tool. It's a learning support tool, right? That being said, if you're looking into the material, you already have lectures available, but this is definitely more condensed, right? So anything I go over here, I would advise you to make flashcards and study them. Um, the lectures you have, they're great lectures. They go over everything. But when you're taking, quizzes and exams on a weekly basis, and your prep time is just a few days, you need to somehow condense the material, which is what I'm doing here with this learner support tool. So anything, absolutely anything I cover here, you must absolutely know. So make flashcards out of everything I do here. I provided the PowerPoint, but of course this is the video version of it. And in the PowerPoint, I wasn't able to clarify what I'm saying right now, the importance of this learner support tool. Some students jump ahead and they start taking quizzes um, without watching the videos, and that's a big mistake. Watch every single video I post from start to end. Do not fast forward. Make flashcards of everything I say. Anyway, I wrote about myself. I think in the introduction, basically started my way in the lowest level of the pyramid as a medical assistant, worked my way up to becoming a doctor. From a teaching perspective, it's kind of been similar. I've taught the lowest level up until the highest level. And I remember teaching RN students at one point and being shocked they weren't taught medical terminology as a separate course because they were struggling, right? I was teaching anatomy and physiology, and I was dissecting words, and they were, behind, right? Because they never took medical terminology as a separate course. So, all right. All that being said, let me just get started here. If you have any questions, you can email me. Actually, you can text me as well, right? All right. Let's move on. All right. So, this course is a little different from other courses where you have to do, extensive reading. Here, what you absolutely need are flashcards, right? Because the word parts are what? The prefix, right? The root, it has a vowel, be a combining form, and the end of the word, which is the suffix. The part of the word that precedes or is placed before the root or combining form is the prefix. Pre, right, is actually a prefix, right? Uh, Itself, right? So pre means before. But here I'm going over, and in the lectures, they're going to go over a lot of word parts. I'm going some specific ones I want you to know, right? So we start off with the prefixes. What's a prefix? It's the part of the word that precedes or is placed before the root or combining form. And the first one we have is anti. Anti means against. So that's where you take your flashcard and you flip it, right? So anti means against. Epi means above upon, right? Let's move on. Next prefix is hetero, right? Hetero means different. Homo means same, right? Hetero means different. Bi or die both mean two, right? So bi and die means two. Make a flashcard. Prefix is bi, the meaning is two. The prefix is hetero, the meaning is different. Right, let's move on. Suffix noun, IC, right, means pertaining to. Itis means inflammation. So IC means pertaining to. Itis means inflammation. Suffix, which we said was right after the combining form or root, right? And now we have the suffix gene. Gene means formation, origin. Ology means study of. Root means, well, you have a root without with a vowel would be a combining form, right? So dem, the root dem means people, population. The root tus means cuff, right? So if you hear of a drug that's an antitussive, right, it's a drug that is preventing, treating, right? Anti means against, right? As we know from a few slides ago. And tuss means cough. Malaysia is a suffix meaning abnormal softening. Pathy is a suffix meaning disease. Prefix sub means under, less, or below. The prefix hypo means deficient, right? So if someone has hypothyroidism, that is deficient thyroid hormone. And, the subcutaneous layer of skin is under the dermis, right? Subcutaneous. Sub means under, less, or below. Full terms now, histology, which is made by the combining form histo, which means tissue, and the suffix logy, which means study of. And histology, therefore, is the microscopic study of the structure, composition, and function of tissues. Then we have the term epidemic, right? Epidemic is the sudden and widespread outbreak of a disease within a population group or area. So histology, microscopic study of the structure, composition, and function of tissues. Histo means tissue, logy means study of, right? This term is a directional term, right? And the directional term here would be medial. Medial is a direction towards the middle of the body, right? So the imaginary mid-sagittal line, whatever is in close proximity to that, right, when comparing two structures, would be considered medial. Example, the nose would be medial to the ears, right? It's more on the midline. So that's what medial means. AL means pertaining to. MEG, right? I means middle. Gastritis, right? Gastro means stomach. So GASTR is the root, meaning stomach. Itis is a suffix meaning inflammation. So gastritis would be inflammation of the lining of the stomach. Now, we have homeostasis, right? Maintaining a stable internal environment, right? When you take vital signs, right? The reason there's an average blood pressure is because that's the blood pressure at which the body works best, right? Same, I think temperature is a better example, right? So temperature has an average of 98.6 Fahrenheit, about 37 degrees Celsius, but it's really a range. 98.6 is an average, right? So it goes, in terms of oral temperature, from 97.6 to 99.6. So if we take that as an example, that means the body works best at that range, right? At the average of 98.6. And working best means production of hormones, production of enzymes, right? Neurotransmitters being released, all the chemistry happening inside the body. So litho then is a stone, right? Tomi means incision. So litho means stone. That's a combining form. Tomi is a suffix meaning incision. And together we would get the word lithotomy, which is the surgical incision for the removal of a stone, right? Then we have the word arteriostenosis. Arteria means artery. Um, and stenosis is the narrowing, right? So arteriostenosis, therefore, would be the narrowing of the artery, right? All right. Syndrome, signs and symptoms that occur together, right? That's a common word in medicine. So arteriostenosis is the abnormal narrowing of the artery. Um, and syndrome is the signs and symptoms that occur together. Dysfunctional, yeah, so dysfunctional means this is a prefix meaning bad, painful, difficult, right? Um, and dysfunctional, therefore, means an organ or body part that is not working properly, right? And then we have acute, right, versus chronic. And acute means the sudden onset of a disease, right? We have some more suffixes. We already did this before, right? Ology means study of. Rexis is a suffix meaning rupture. Osis is abnormal condition, and whereas ostomy means the creation of an artificial opening, right? Rhea means flow or discharge, also a suffix, right? As in diarrhea, right? Flow or discharge throughout. Combining forms, adipo means fat, right? As in adipose tissue, right? Steato also means fat. Adeno means gland, right? Caudo could be used as inferior when you go over directional terms in anatomy, right? You have the superior and inferior. So the feet would be inferior to the head, right? But a word that is synonymous with inferior is kodo, which actually means tail, right? But basically, that would be the lower part of the body. I mentioned hypo being deficient a few slides ago. Hypothyroid meaning deficient thyroid hormone. Therefore, hyper means excessive, right? We have aplasia. A alone means no, not, without, right? Plasia means formation. So if you take the entire term, no, not, no formation, we have defective development of an organ or tissue. And then we have the word erythrocyte. Erythro is a combining form meaning red. Cyte is a suffix meaning cell. Erythrocyte therefore means mature red blood cell, right? There's, I think, one section that talks about body membrane. So parietal peritoneum is the outer layer of the peritoneum that lines the interior of the abdominal wall. Huntington's disease, genetic disorder that causes nerve degeneration with symptoms that most often appear in midlife. So in Huntington's, we kind of have the opposite of Parkinson's. In Parkinson's, what's the problem? High dopamine and a relative high acetylcholine. In Huntington's, you would have, high dopamine and relatively low amounts of acetylcholine, right? So you basically get, what's called chorea, which is kind of a dancing movement, involuntary dancing movement. Um, but there's definitely nerve degeneration there. And that was the last slide, guys. All right, perfect. All right, I'll do something similar. In week two, the purpose of this was to condense the material, give you an insight of what you need to know. Please make flashcards of this. And yes, if you have any questions, feel free to, you can actually text me, um, or email me, right? All right. I'll see you for week two. And thank you.